On this Wednesday morning, it is Morning News Today. Welcome back. Patients often end up worse off due to infections contracted in hospital, and with a rise in antibiotic-resistant bacteria, hospital-acquired infections are on the rise worldwide. Now, children and babies are at risk, as well as elderly patients, malnourished individuals, and those living with HIV also have an elevated risk of contracting these infections. Now, DSC Attorneys Senior Associate Johann Roux joins us to talk more about this. He's in Cape Town for us today. Johann, a very good morning to you. Let's firstly, before we go to the legalities of all of this, talk about how rife this is and what we see happening with the hospital-acquired infections and due to antibiotic-resistant bacteria.
Hi, good morning. Yes, there's certainly been a big increase in these hospital-acquired infections worldwide and also in South Africa, where you now get the emergence of what they call superbugs. That is, bacteria and infections that are resistant to all the antibiotic treatments that we could possibly give to counter it. And we've certainly also seen a big rise in that in terms of the people that have come to us and asked for advice on possible litigation.
So what are we seeing happening here, Johann? Are we seeing people going in with one type of illness, they're getting sorted out with that's being taken care of, but they're coming out with something worse, and we're actually seeing this resulting in death?
Yes, certainly so. People go to hospital sometimes even for minor procedures, and during their stay in hospital there's a transmission of an infection that they then pick up there, and sometimes with quite devastating consequences.
So what have we found, or to your knowledge, what is the cause of this? Is it sort of hygiene issues at the hospital? Is it something that is avoidable yet it's still happening at our hospitals?
It's a combination of factors, and in that sense the hospital and the patients are guilty. Firstly, the hospitals do not necessarily employ proper sterile environment procedures, so you get the spread of infections. But also patients also contribute to that in a sense, because they do not take the antibiotic treatments as required. They don't finish the antibiotics course, and what happens is that these bacteria then become resistant to those antibiotics, and they then spread those bacteria to other patients in the hospital setup, and you get the situation that you have now. And lastly, you also get the doctors that prescribe antibiotics for cases that they should not necessarily do so, and that also causes, you know, the bacteria to become more resistant.
So in a case where someone has fallen victim to this, or families where they've probably lost somebody because of a hospital-acquired infection, Johann, is there legal recourse? And how would you prove that this is because you have this is something that was picked up in hospital?
Yes, you'd certainly look at what the patient went into hospital in the first place, and then try and determine what infection did they pick up at hospital. Then you would go and investigate, you know, whether the hospital firstly had a proper procedure in place to prevent the spread of these infections, and if so, see to what extent you can determine if they actually did follow those protocols that they had set in place. And if they did not have a proper plan in place, or they did not follow the proper plan, in that case there could well be liability.
To your knowledge, Johann, has anybody successfully fought any of these cases or claimed from a hospital?
Yes, quite a few of those cases, and there's been quite a few tragic cases, you know, people that have gone in for very small elective, sometimes even plastic surgery procedures, and they've ended up with devastating consequences, even death in some cases, where we certainly have had successful cases.
Okay, so what would be your advice? Where does somebody begin if they suspect that you know, this is what is happening to them or someone in their family?
I think what they should do is just set out a complete set of facts, you know, summarize exactly what happened, and then contact a law firm that specializes in medical law. Those attorneys, we're well trained to spot cases where we know this is worth investigating further, and the attorneys will look into it for the family or the patient that fell victim.
All right.